Fluid and electrolytes. Let's get started. A solution in which the concentration of both solvent and solute are equal. That poor kid. What is a solute and a solvent? Why, heck, it is an isotonic solution. A solution to clean the restrooms? Who needs a solution? Why, heck, it's an isotonic solution. Equal is isotonic. I want you to remember that right now. Equal is isotonic. That's your normal saline, your D5W, and your LR. These two electrolytes are married. What are they? Let me see, potassium and sodium, sodium and chloride, potassium and chloride, or sodium and sodium? Sodium and chloride are married. When sodium goes up, chloride will go down and vice versa. They have an inverse relationship, but they're always together. So wherever sodium is, chloride's there. And that is your extracellular fluid. And just remember, sodium is what really controls volume. It is the one that's in charge of the volume. My range is 3.5 to 5.0, and too much or too little, I will upset my heart. Is it phosphorus? Is it sodium? Is it calcium? Or is it potassium? It is potassium. I want to make sure that you remember that your normal range is 3.5 to 5.0. Anything under 3.5 is hypo, and anything above 5 is hyper. Hypo and hyperkalemia. And too much or too little will upset the heart. Remember, it's cardiac related. There are a lot of other things out there, but just remember potassium with cardiac and sodium with neuro. And that will help you a whole lot. Chronic diarrhea, malnutrition, prolonged gastric suction, and chronic alcoholism cause what? First of all, that is my little puppy dog. Hypermagnesemia, are you crazy? Hyperkalemia or hypomagnesemia. If I'm losing it, chronic diarrhea, malnutrition, prolonged gastric suction, I'm losing stuff, right? I'm losing it out one end. I'm losing it out another. It seems like things, I'm not gaining it. It's something, I'm not getting it. And then, of course, chronic alcoholism. If we drink and drink and drink, then we can have hypomagnesemia. Hypomagnesemia. That's your low magnesium. You lose me when you vomit, have diarrhea, and excessive urination. Who am I? I think they're cute. Potassium. If I vomit, I have diarrhea and excessive urination, because you're going to learn different disease processes as we dive deeper into med-surg. But just understand, if you're losing it, vomiting it, diarrhea, or excessive urination, we're going to lose potassium. If I take a diuretic, like a potassium wasting diuretic, which is furosemide, I am going to lose or urinate potassium. When you need to know if they have a fluid volume decrease, how do you know? We're looking at decrease. When you read those questions or when you're looking at things, look at decrease, look at increase. Make sure you highlight, underline, make sure you realize what you're assessing. Are we going to check turgor? Maybe. Check urinary output? How about don't care? Or how about check for pitting edema? We're looking for fluid volume decrease. We're not going to have edema. Could we check for turgor? Not the best. Remember I said you can do it. Really young children, healthy children, older children, teenagers, healthy adults. We get to the elderly, the skin is just not as elastic. The elasticity is gone. And so turgor can be difficult. But you do want to, if you're checking turgor, you could pinch on the sternum. You can pinch the skin up to see if the skin's going to tent. But the best answer here, if you need to know if they have fluid volume decrease, is to check their urinary output. And the reason why is the thing that we see first will be a decrease in urinary output. They're going to have a drop in their urinary output because the body is going to try to hold on to fluid. And so because we know then we have a volume decrease, and we're going to then have decreased urinary output because everything's going to kick in, our RAS system, and then we're going to try to hold on to the fluid. I'm old and dry. What else am I? Young and beautiful, confused and falling, on my A game, or hydrated and ready for Christmas. I'm not. I got to get there though. I like that little squirrel. I'm confused and falling. If I'm dehydrated, if I am dried up and I am elderly, I have an increased risk for falling because of confusion and balance issues due to the dehydration. I can be confused and I can fall. I'm unable to do those things when I am old and dry. If you don't want me to strain, give me what? Stool softener, emollient, barbed wire, or a bulk laxative? He looks like he's straining. A stool softener. Now I'm going to say this isn't one of mine, but I used to teach it and it was on mine, so I went ahead and put it in there. But I thought, what would it hurt? Because everybody needs to know, if I don't want them to strain, I'm going to give them a stool softener. I don't necessarily need to give an emollient or a bulk laxative or barbed wire. I just need to give that, soften it up so that they're able to have a normal bowel movement, that they don't have to strain. Post-op surgical patients, mothers that just delivered, we don't want them to push. Elderly people, you know, things slow down. If I'm taking pain medicines, things like that, I want to give that stool softener. Because guess what happens? If they strain enough, they can brady down, have bradycardia, and pass out, or even cardiac arrest. If a patient gains 2.2 pounds in 24 hours, how much fluid is he retaining, or she? 1 liter of fluid, 2.2 pounds equals 1 liter of fluid? I'm not sure. I'm going to go back to that here in a second. It doesn't matter. Is there an equation? Yes, look above. And CHF patients must weigh daily for this reason. 1 liter of fluid is 2.2 pounds. So the question is if a patient gains 2.2 pounds in 24 hours, how much fluid, how much am I going to count for that? I'm on the scale and, oh my gosh, I gained 2.2 pounds. I have CHF. What am I thinking? How much is that in fluid? How am I going to count that? Well, 2.2 pounds of weight on the scale is equal to 1 liter of fluid. Now, if I have a CHF patient They must weigh daily for this reason. That is an answer, and that is true. Because if I have congestive heart failure, I get on that scale and I have an increase in weight, then I am going to have an increase in I'm going to have an increase in fluid overload. So I need to know. That's what we teach our patients. You get on the scale. If you have 2-pound weight gain in a 24 to 48 hour period, then you need to be calling a physician. You need to be calling the office. You need to be calling and getting some help, because that's a lot of fluid. So if 2.2 pounds is equal to a liter of fluid, then we have a liter of fluid on. If we don't do something in, say, 4 to 6 days, how much fluid are we going to have? And I just want you to know, a 2-liter bottle is something we drink of soda and stuff. You see the 2-liter bottle? It's half of that. That's what's on the body. Not good. So 1 liter, just so you know. What a dynamic scene. What else is dynamic? Osmosis, filtration, active transport, or the shuttle launch? I wish they played different music. I was going to say better, but I don't want to. Active transport. It is dynamic. It is a dynamic thing. It needs ATP. It's got to take the actual fluid and move it. It is not, it is something that's wonderful. Is the space shuttle dynamic? Yes, the launches are dynamic. Is osmosis? I won't call it dynamic, but it is something that's good through a semi-permeable membrane. What about filtration? It's good too, but it's still not a dynamic process. And if you're looking for that, it's active transport. If you have this much urinary output an hour, should you call the doctor or MD? 30 milliliters or less an hour, the physician needs to be called? Yes. In 24 hours, would I take the total urinary output and divide by 24? Yes. Am I calling a doctor with less than 30 an hour? Yes. Do I divide the hourly time and the urinary output to get your answer? Yes. All 4 of these answers are correct. If I have 30 milliliters or less of urinary output, I need to call the physician. That is not, it's not good. We're going to shut our kidneys completely down. They're in that process. In 24 hours, I would take my total urinary output for my 24-hour total urinary output, and I would divide 24 into that. And that is going to give me an average of how much urine is put out per hour. If I'm less than 30 an hour, I need to be calling a physician immediately. Am I calling a doctor with less than 30 milliliters an hour? Not sure about the "than" in there. I apologize for my English there. Yes, I need to. And do I take the time in hours? If I do 5 hours and I have this much urine, I empty my bag in 5 hours. I've been on my shift for 5 hours and I empty this bag and I have this amount. I have a number. Let's say 100 milliliters. I know that I'm going to take 5 divided into 100. And what am I going to get? 20 mLs. Is 20 mLs sufficient enough for the kidneys to function? Am I functioning normally with my urinary output, with my kidneys? Am I doing what my body needs to do? The answer is no. And I would call a physician because I am 30 milliliters or less an hour, because that is so vitally important. This is a test review. I hope it helps. Please focus on dehydration. Please read your questions very carefully. Make sure that you're reading each word for what it is. And always think, what is the priority of care? What do I need to do first? And I'm just going to say this to you. If I'm throwing up and having diarrhea, I hope you will stop both of those before you start to try to get an IV in me or give me something to drink or do something like that. Stop what's going on. Give that antiemetic, give that antidiarrheal, stop everything, and go ahead and replace the fluids then after that. What do you do first? I hope this helps. See you soon.